My name is Dr. Kimberly Mann, and I am an assistant professor of social work at Chicago State University, and I'm also doing consulting for the Chicago Safe Start Project.
Eddie needed to talk. There was something inside him, and he couldn't get it out. It was a big thing. Nobody knew it was in there. That he'd seen some scary things at home or in the neighborhood.
Well, we haven't always known that simply seeing scary things, whether it's in our homes or in our communities, could harm children. But now we have more than 10 years worth of research that concludes that exposure to violence does harm children, and in fact that harm can last for some time. The effects can vary based upon a number of factors that we know about. They vary dependent upon the child's age and their developmental stage, the child's relationship to the victim and to the perpetrator, the child's proximity or their closeness to the event. What was the child's relationship to the injured or to the threatened person? And probably most importantly, was anyone available to listen, to reassure, and to care for that child after the event?
He was afraid that if it came out, he might get hurt. Or somebody else might.
The problem with violence is that it exposes children to events that can leave us without words. It's important that adults care for children and help them to talk about their worries and their fears. Even when children are very young, it is important that adults notice even the small changes in their children's behavior. Eddie is really communicating a very great deal.
But it was hurting him anyway. He couldn't pay attention. He couldn't sleep. Sometimes he even wet his bed.
Eddie is experiencing behaviors that we often see in young children after a significant fright. These symptoms result from being afraid and overwhelmed. A child may return to an earlier stage of development. They may become clingy, begin bedwetting. Their behaviors may appear to be babyish or even infantile. The child may try to avoid people or places that remind them of their fears. And this behavior may appear as though the child is being stubborn or defiant. They often have nightmares. Some children become quiet or withdrawn.
He was doing other things. Angry things. Mean things.
Acting out behaviors deserve special attention and special understanding. The research tells us that adults, parents, and professionals like teachers and other helpers, focus a great deal on acting out behaviors, but they may fail to see what's behind these behaviors, the worries and the fears. The child may get the message that they are bad. Their behavior is certainly bad, but no one is recognizing that beneath the anger and the frustrating behaviors are their worries and their fears. It takes a great deal of effort to get to the fear. Adults have to deal with their own frustration that result from children's misbehavior. It helps if we correct the misbehavior and still ask the question, is there something else going on here? Sometimes children become unusually quiet, they try to be good, try not to act out. Again, we still have to ask the question, is there something else going on here?
Nobody knew what was up with Eddie. Grandma patted him. His dad tried to scold him. His mom hugged him.
As we see in the story, few adults were able to get to the heart of Eddie's fears. We get so busy, we get frustrated, and most of all, we just want the problem behavior to stop. We often try things that we know worked with other children. We may even try things that worked when our parents disciplined us.
One day, a neighbor lady was looking at him in the light. She turned to his mother.
Your boy's got something in him. I can see it.
I love the neighbor. Something in her background helped her to see that there was something more going on inside Eddie. Notice she didn't have to say a great deal.
You're a really big boy to carry all that around in you. What is it? What's in you?
She lets Eddie know that she believes there's something important that he's dealing with, and that she's a safe person to share his worries with.
She didn't sound like she would hurt him.
Baby, put it into words.
He wasn't so sure.
He may not take her up on this offer right away. In my research and clinical practice, I hear young people talk about the adults who saw beyond their walls, their inappropriate behavior, and were able to see their hurts. These young people often pushed those adults away and tested them to be certain they could be trusted with the stories that they had to tell. The people who helped had some common characteristics. They were good listeners. They were good observers. They were patient because the trust often didn't develop overnight. They've often been the key people who help these young people to survive, to get help, and to overcome their circumstances and become what we often consider to be resilient. These people can be parents, teachers, social workers, coaches, or neighbors. They are all people who care deeply about children. The special sensitivity that these caring adults demonstrate may come from a variety of experiences and skills. It's key that these adults are open to thinking about the things that may be going on in the environment that may be contributing to this child's behavior. Behavior is always a way of communicating. It's not simply a deliberate attempt to defy adult authority, get your way, or to just try our patience.
I'm scared. I'm so scared.
And then it all came out. In words that didn't hurt anyone at all. In fact, they helped.
When children do trust us enough to share their experiences, it is critical that we handle their trust responsibly. We want to connect them to help, the help that they need. Schools are often a great resource for this. School counselors and social workers can provide support and information on other resources within your community that may assist a child that has been exposed to violence. Police officers may also have special training on community resources for families when violence is a problem. All children are at risk when they're exposed to violence in their homes and in their communities. The risk affects them in all areas, their learning, behavior, emotions, and their development. Caring adults who are able to love, support, and shelter young children are vital to protect them from these potentially harmful outcomes. Parents may feel helpless if they're in a violent relationship or if they're living in a violent community. It's critical that they establish and nurture their own support networks and not let their circumstances allow them to become isolated and alone. Isolation poses the most dangerous situations for both the parents and for their children. Support is vital. As professionals, it's important that we help families develop their support networks. This is a critical step in supporting parents so that they are able to listen to the messages that our children are trying to tell us, often not in words.